Welcome back to Island Life Live, providing advanced orthopedic and shoulder care with a special emphasis in shoulder surgery, joint replacement, sports medicine, and trauma care.
The dedicated team at Hawaii Shoulder and Orthopedic Institute is there to help you regain mobility and live pain-free.
One of its team members joins us now, board-certified orthopedic surgeon, Dr. J. We call you Dr. J because I had time to see your last name.
Boughanem.
Boughanem.
J is fine. That's pretty.
Dr. J.
We like Dr. J. You know, it sounds like a sportsy kind of guy. That's why. Yeah.
Perfect.
We do a lot of sports kind of, fixing up. So
makes sense. So, Dr. J, today we're going to talk about hip pain and labrum tears. Of course, I know what a hip is. Where's the labrum, and what does it do? What is a tear?
So the hip joint is part bone and part cartilage, and the cartilage part is the labrum. So it kind of. I brought this model here to kind of show. So these are the ligaments of the hip joint, and this is the bony hip joint, and surrounding the entire bone, circumferentially, pretty much 360 degrees, is the cartilage piece. So it's a soft cartilage that surrounds the hard bone.
And that's what you call the labrum.
And that's what we call the labrum.
I got it.
You have the labrum in the shoulder, you have a labrum in the hip. And that's the area that allows more motion. So if it's all bone, the bone will constrict motion, obviously. Because we have a labrum, there is more range of motion that's allowed, because the labrum is soft and it can allow the femur to move in the socket, but it's also very prone to injury. It's
right, injury, and that's the stuff that tends to degrade over time too, sometimes.
That's very true. There's two things that can cause degradation of the hip joint over time, and one of them is developmental hip dysplasia, and the other thing is impingement. And that's the hip impingement. It's kind of similar to the shoulder impingement idea, where the bones have either a pincer or cam type deformity, meaning that the bones are a little bit overgrown or larger, so the labrum is being pinched by the bones, and that can cause the labrum tear and the symptoms of hip pain and sometimes mechanical symptoms as well.
Now, Dr. J, how would we know that we're suffering from that? I mean, what are the symptoms? I know you're saying pinch. Is that the kind of feeling that we feel in that joint, in here or here, like a pinching feeling?
So the pain when people have labrum tears, and usually it's either groin pain or C-shaped surrounding the hip kind of pain. And there can be associated sometimes mechanical symptoms, clicking, catching, or giving out. Sometimes people are hard to sit like this, or like they kind of keep moving to get a comfortable position. Sometimes the hip feels like it's super uncomfortable in one position. You have to readjust the thigh bone to find comfort.
All of the above. I've experienced all of them. So I gotta call Dr. J.
Oh yeah. Now, is surgery the only way to fix this?
No, not definitely not. Surgery is one of the ways to fix people with labrum tears or injured labrums or have impingement. But usually we try non-surgical methods first. We try non-steroidal anti-inflammatory medications. We try activity modification, physical therapy, and home exercises. And one thing that we try now, and it's very, very good alternative to surgery, is doing biological therapy with injections. So that helps both relieve the symptoms, and sometimes if you get relief in the symptoms and they come back, then we know that surgery will really work well for a patient who've had a positive response to the diagnostic injections. So there are definitely other treatments besides surgery, but it also depends on the individual, how old they are, what they're trying to do for a living. Are they trying to play sports? Are they a military recruit? They need to go back to the duty, or they need to have the range of motion. Then those patients sometimes may benefit from fixing the labrum and debriding the bone that's causing the impingement and pinching. But sometimes, it depends on the activity level, we can get away with non-surgical management too.
I love that, because we got to stay on the pickleball court. We got to keep active, Doc. You know what I mean? This is board-certified orthopedic surgeon, Dr. J. If people want to get a hold of you guys, we actually have it up on the screen. It's hisoi.com, yeah?
Yes.
All right. Hey, Doctor, thank you so much for flying in. He's based out of Hilo, so we thank you so much for flying over here and being a part of our show.
Thank you. Thank you for inviting me. I appreciate it.
Right on.
Keeping your hips healthy.
All right, we're going to take a quick break, but again, as we head to break, it is National Kiss Day, and here's my question. A casual kiss burns about 3 calories. How many calories a minute do you burn in a passionate kiss? 26, 32, 44, or 57 hot, hot, hot? We'll be right back with the answer right after the break.